Welcome to the University of Michigan Sound Support's 2023 Parent Webinar Summer Series. This is the first of 3 parent webinars we have for the summer. My name is Amanda McGuire, and I am the Sound Support Coordinator for the University of Michigan's Cochlear Implant Program's Sound Support Program. As you may know, Sound Support is an outreach grant funded by the University of Michigan Department of Otolaryngology and Michigan Medicaid. The grant is designed to provide outreach and support to children with hearing loss and families throughout Michigan. We've put together this series of webinars for parents due to the great responses we've had from past webinars. If you have any questions, please email Sound Support at oto-soundsupport@med.umich.edu. Today's parent webinar is titled Let's Map, Understanding Your Child's Programming Appointment. I would like to take the opportunity to introduce our presenters today, Dr. Rachel Friett and Dr. Heidi Slager. Both Dr. Friett and Dr. Slager are audiologists in our cochlear implant program. With that, I'll hand it over to Dr. Friett and Dr. Slager, and we'll get started.
Hi, everyone. My name is Rachel Friett. I am a cochlear implant audiologist at the University of Michigan. And today, myself, along with my colleague Heidi Slager, also an audiologist at the University of Michigan, will be talking to you about how to understand your child's program appointment. So you may be anticipating an activation or programming coming up, and you want to learn more about the cochlear implant process. And hopefully with today's presentation, we can demystify some of the questions or thoughts you have about the process. So the purpose of today's presentation is to allow you to understand what to expect at your child's cochlear implant programming appointment, tips for having a productive appointment, as well as sharing some family support resources. So the first thing we want to talk about is how the cochlear implant functions. So the first thing that happens is from the external device, we call this here the processor. There's a few main functions of the processor itself. You have these black little dots on top of the processor, and those are called microphones. So the microphones pick up sound in the environment, whether it's environmental sound, whether it's speech, and take it in from your environment. So just remember, whenever you're wearing your processor, to make sure that these microphones are not blocked. That way sounds can be muffled or not clear for the child, if it's blocked by a hat or any kind of retention options. The second part of the sound process is the processor itself filters and codes the signal, which then sends the signal up the cable to the internal device underneath the skin via magnet. So right now, all the new internal devices that are FDA approved are MRI compatible magnets, but some of the older devices, some of the older implants are not MRI compatible. So you should understand your MRI compatibility from your surgeon or audiologist. The signal is then sent, so it's sent from the external magnet to the internal magnet via radio frequency and into the internal device. Once the signal is sent to the internal device, it then stimulates the electrodes in the inner ear. The stimulation from the inner ear will send the signal up the nerve and then to the brain. The brain does the hard and important work of making sure that it provides meaning to sound, or that's how it understands speech and those kinds of things. Nowadays, there are some processors that are circular. They kind of sit up top here, and they are what we call an off-the-ear processor, where you don't have something on the ear, but rather everything is all encompassed in one at the magnet site. So if you are a Cochlear America's cochlear implant user, their on-the-ear option is the N8, or the off-the-ear option is the Canso 2. For MedEl, you have the Sonnet 2 processor on the ear and the Rondo 3 processor off the ear. And then from Advanced Bionics, you have the Marvel on the ear processor that are all FDA approved at this point. So you may hear the term mapping from your cochlear implant audiologist. And when we call programming the cochlear implant, we can call it mapping. So that's interchangeable. In the process of mapping, we connect your child's processor to our computer software and make adjustments to the electrode in the inner ear. We adjust the electrodes in the cochlear implant using your child's behavioral responses to sound. So we'll talk more about that, that kind of process of understanding the responses in a little bit. But generally, we play beeps on each of the channels of the electrode through the processor, and your child shows us which of the beeps they can hear. We use this information to set the lowest amount of current it takes for your child to hear and the highest amount of current that is comfortable. The purpose of mapping is to make sure your child can hear the sounds of speech and that they are comfortable with the sounds that they are hearing. We need soft sounds to be soft, we need medium sounds to be medium, and we need loud sounds to be loud but not uncomfortable to provide the best quality of speech understanding. In the first year of getting the implant, we see children quite a bit, quite a few appointments, because we need to ease them into sound by slowly increasing that current level, or what we say, providing a window of sound and increasing that window of sound more and more with each appointment. This is because the child's sound tolerance for the processor is small at activation, but it increases over time as they use their device. Eventually, over time, their programming levels will stabilize, and that's usually around 6 to 12 months after activation. And at that time period, we then make the decision to see your child every 6 months for mapping. And then once they're older, we'll do it annually. So we will continue to see your child throughout their life for cochlear implant programming, but it becomes less frequent as they get older. There are some ways that you can prepare your child for this mapping appointment, and sometimes parents will ask us, how can we prepare for success in mapping or programming? Here are some ideas on how to get ready for a programming appointment. One is consider scheduling these appointments when your child is rested and fed if possible. Because we rely on behavioral responses for mapping, and if your child is sleepy or upset or hungry, they're less likely to reliably respond to our tasks during the appointment. There are some things we can measure without their response, what we call objective measures, and Heidi will go into that in a little bit. But your child's responses are the best way to set the implant. The next way we can prepare is to talk to your child about the appointment ahead of time. So if you're going to be seeing us, you can talk to them about who you're going to be seeing, what you're going to be doing, all of that kind of information. This will minimize anxiety and fear and confusion that may come into going new places, seeing new people, going to a doctor's appointment, having unfamiliar people touch their ears and their processor, things like that. You can even take pictures of our clinic if that helps, and then look back at them before the appointment as a reminder of where you're going and what you'll be doing. You can also practice listening at home. So we will show you what to expect in a couple videos in a few short slides. But there are some techniques, what we call listen and drop. And that means when you hear the sound, you pair it with an action. So for example, when you hear the sound, drop the toy in the bucket. Or when you hear the beeps, put the puzzle piece in the puzzle. So we call that a conditioned play response. We are conditioning your child to respond to sounds through play. And we'll go through that and then what it looks like in a little bit. But wait, there's more. We are going to go through a lot of information at the day of the clinic or on the day of activation when we turn the processors on, essentially. So you will receive a backpack full of supplies, documents, accessories. So it's totally understandable if you don't remember everything or understand everything right at the first appointment. It can be helpful to come prepared to future appointments by understanding what kind of things you want to review. A lot of times families will bring the backpack back with them for their upcoming or their next appointments in the activation series, so then they can re-review some things that didn't stick. You can also, it's helpful to us when you share ways in ways that you notice that your child is responding to sound. So did they notice a new sound? Did they miss a sound you expected them to hear or that they used to hear? Are they making new sounds or using new words? Was anything too loud? So that information gives us a lot of insight as to how your child is doing with the device. And also is important to know how your child is bonding with their device and how their speech and language is developing. It's helpful to share it with both our audiologists as well as their auditory verbal therapists or speech language pathologists. And we both work on setting your child up for success. So like I said, a lot of times patients will get overwhelmed or families will feel like it's a lot of information at the activation appointment. So bring that backpack back at subsequent appointments. Many times parents go home and rifle through the backpack, which we encourage. It takes a bit of time to get familiar and used to all of your equipment, and you should feel comfortable bringing any and all parts back to follow-up appointments if you'd like to re-review some of the parts. We can certainly add time or include it into the appointment. We want you, in the end, to feel comfortable with your child's supplies and devices and doing the right thing in terms of when something's not working or learning more about how to use the devices in their activation kit. So that's all to say, building up to activation day. So when your child has gone through the preoperative process, they underwent cochlear implant surgery, they've waited a few weeks to heal, then they come back to the cochlear implant program to what we call their activation day. This is the appointment where we turn the device or devices on. You don't have to bring anything with you. We will have your new processor and backpacks of supplies waiting for you here at the clinic. The appointment is long. It's about 2 hours in length. So the first hour is for programming, and then the second hour we take to review the use and care of your child's equipment. After we program the implant, we turn the microphones on and then let you speak to your child for the first time. We know this is a big moment for you and your family, so we definitely encourage taking pictures and videos of that moment. And unfortunately, our offices aren't particularly big, so we can't have too many people in the appointment, especially two, because we don't want to overwhelm the child or get distracted by all the people in the room. So it's best to limit the number of family members you bring, but make sure you take a video to send to your family members to celebrate your child's hearing birthday. So I've alluded to this a little bit earlier, but the question is, what do we do at activation day? So we set the amount of electric current the implant gives the ear at a comfortable level so your child is not overwhelmed by sound. So we audiologists want your child to have a happy experience with their processors. They are not yet used to hearing sound from the implant. So if we give them all the sound at once, it might be really overwhelming to them. So we set the map at a comfortable level when we turn the microphones on. And I like to give the families a little thumbs up when we're turning it on, so then they can say the first words. Something to really reiterate is that any response that your child gives during this activation day is totally normal. Any response is considered a good response. So hearing for the first time can be exciting, it can be strange, weird, sometimes even a little scary. So because of that, some kids will laugh, some cry, some do nothing at all, and all of that is common and normal responses. The most important thing that you can do for your child's activation is to make sure that the processor is turned on, that the coil is on their head, and they're wearing it as much as possible. So when you go home, that's your assignment for the next week. And our goal is for your child to wear their processor whenever they're we call eyes open, ears on, whenever they're awake. Full-time use of the processor is the most important controllable factor in influencing your child's success for listening and learning to talk. If you're hearing, if you're giving your brain some sound, your brain is learning how to listen, and then in turn, they can learn how to express spoken language. Your child needs to hear sound and speech over and over to learn that sound has meaning, and then they'll learn to mimic those sounds and eventually talk. If your child wears their processors only a couple hours a day, their brain is only developing, growing, and learning about speech and language during those hours that they're wearing it. So it's important to really wear it as much as possible during all waking hours. We will be able to share data logging information, which that means how many hours on average a day your child is wearing their processors. And every time we connect them to the software, it gives us that information to share. This will be able to gauge how close you are to meeting your listening and your listening goals with the processor. And it'll remind us to talk to you about strategies about increasing that device wear use or hours per day, if that is a struggle for you. Okay, so after your activation appointment, your child will periodically come back for more mapping. So at our clinic, we see our pediatric patients 1 week after activation, 1 month, 3 months, 6 months, sometimes 9 months, and then 1 year after activation. So all of this is because of the amount of current or power that is needed for the processor for your child to hear optimally changes a lot within the first year as their brain acclimates to sound. We also may give you something what we call progressive maps at early appointments so that you're able to increase this window of sound between appointments. So you're able to kind of work on increasing access to sound more and more without having to come in. So creating progressive maps. What that means is setting programs. So typically you have 4 programs. You'll leave the appointment at program 1, then program 2 is a little louder, program 3 is a little louder, and program 4 is a little louder. So we'll show you how to increase those maps or those programs at home. So then by the time you come back to your next programming appointment, your child should be at program 4. Then we do the mapping all over again, and that's their new program 1. So every time you come in, especially in the first 6 months, we'll give you progressive programs so you're able to increase that window of sound more and more to a point where it would be an appropriate amount of current for your child. If you happen to increase to a louder program and your child has an adverse reaction to it, we'll talk to you about this as well, but feel free to go back to the previous program if their child is not comfortable at one of the louder programs. So then at that next appointment, we do mapping repeated, and then new progressive maps are created from there. These changes in programming get smaller and smaller over time, and until they stabilize and your child has enough current going to the processor for them, or going to the implant for them to hear well. So once you reach that plateau or that stabilized map, then progressive programs are no longer needed. Your child will always need periodic mapping every 6 to 12 months to ensure that the device is functioning, that they're hearing well, that their language is progressing, and that their processor is up to date. So there are some ways for you as a parent to change programs and other kinds of adjustments to the cochlear implants. So with your activation kit, you'll get a standalone remote control where you can increase programs or volume. And then you can even track where the device is if it's lost. And that's helpful with the app. So a lot of parents now use the app for iPhone or Android where they can connect to their child's processors, and you can adjust the settings without needing to have like a remote control with you. So this is very convenient for families, being able to check different features of the processor, finding it, changing programs, all that stuff, all within an app on your phone. So earlier we talked about playing sounds for your child during programming and teaching them to tell us when they hear the beeps. So I want to show you an example of programming where this is a child who's between this is a child who's maybe about a year old or a little bit more than a year old. And we are doing video reinforcement audiometry. So this is a listening task that's helpful for kids between 6 months to 2 to 3 years. And at this age, we will play a sound and see how the child responds to that sound and reward it through a visual stimulus. So what we do is we play a beep or a sound through the processor, and then we teach your child to turn their head when they hear it, and then they get rewarded with the picture on the iPad. During programming, you may hear beeps out loud, like from the speaker, but that's just to tell us or to tell my test assist that I'm playing the sound for the child. So it helps us all understand that we're playing a sound, but really that sound is being stimulated through the child's implant, through the software. The sound the child hears will get louder or softer depending on their responses. So we can find and save exactly the softest sound they can hear. So during your testing, your job is to make sure you don't give any hints when sounds are being played. So here's an example of one child doing VRA for mapping.
Yeah. And you're so you'll be
Hear that? Yeah. Hi. Condition for 2 more.
there it is.
I think he's got it.
So you can see him turn his head whenever he hears that beep. He heard the beep, so he's playing, he's looking down, and then when he hears it, he turns his head over to look at the visual stimulus. Oops. Okay. The next way we can do this is for some of our older kids, called conditioned play audiometry. So one thing is to note is that in the last video, we say, good job, or you heard it, but their microphones aren't on. So they're not actually hearing us say these things, but we just like to get excited for our kids and be happy for them. And so they may see our facial expressions, get excited when they respond, but their microphones on their processors during programming are not on. So we're saying those positive things, but they're not actually hearing us. So anyway, when we transition to conditioned play audiometry, this is when kids become maybe 2.5, 3 years old. They kind of get bored on looking at a visual stimulus. So this is where we teach your child to hold a toy, listen, and then perform an action when they hear the sounds. It could be, putting toys in a bucket, or in this case, she's putting coins in a little piggy bank. So those are all kinds of games that you can play with the children. So here's an example of programming through CPA.
She did not hear this one.
Oh yeah, I was gonna say she's looking at me.
Yeah, perfect. Good job.
So she didn't hear that one.
Here's where she heard it before.
There you go. So she heard. So again, that external stimulus, that sound that you're hearing is not what she's hearing. We're just playing it. That every time we play it, it plays it out on a speaker. But in her implant, we're making it softer or louder, seeing exactly what current needs to be played so that she can respond to some of these sounds. So here's an example of how you can prepare or practice doing some of these listening activities at home. So you can make sounds verbally, or you can use other sounds at home and prompt your child to look for it. And of course, celebrate when your child responds to that sound. At home, you are the reward instead of the picture or the screen. So you can cheer and you can get excited over the response to the sound. Once the child is about 2.5, we will work on graduating them from looking at a sound, the VRA, to completing a task when they hear it, or conditioned play. You can also practice conditioned play at home with games or toys. It's especially helpful to teach your child the ready pose. So then they hold the toy to their ear and they wait, because waiting is always the hardest part, especially for these kids. Every child has good and difficult days with programming, so we expect the need to add appointments as needed in order to ensure that your child's hearing best. So practicing these tasks can help increase the odds that your appointment can be used efficiently and effectively to program your child's implant. But if they're having an off day, we can always add another appointment onto their activation series if needed. So here is an example.
Good job. Yay. Beep, beep. Yay, Kareem. Good job. Perfect. Yay! Perfect job. Perfect job. Super. Super, super.
So he was conditioned to hear some of the ling sounds and do an action or putting the ring on the peg. So now I'm going to turn it over to Heidi, who will talk a little bit more about what goes into programming a cochlear implant and the software, and explain some of the terms we use during mapping appointments.
Hello, my name is Heidi Slager. I'm an audiologist on the cochlear implant team here at University of Michigan, and I'm going to continue talking with you today in a little more detail about what your child's cochlear implant programming appointment will look like. So when we think about performance following cochlear implantation, there are a number of factors that you can control and some that you cannot. Some of the factors that are outside of your control as a parent or caregiver of a child with a hearing loss and cochlear implants is oftentimes the cause of the hearing loss, the age the hearing loss began, the amount of residual hearing or hearing that's usable in the child's ear that was implanted or the opposite ear, their ear anatomy, or other health conditions that they may be working on or dealing with. Some of the factors that are within your control as a parent or caregiver are whether a child uses amplification or hearing aids and how much prior to implantation, the age at which they receive their implant. Children can receive implants in the US as low as 9 months of age, according to the FDA. Your family support, how involved you are with your child's treatment plan and following up with practice exercises from your speech therapist and the rest of your team at home. And then more specifically, what we're talking about today is attendance at and engagement in your child's programming appointments. So what does that look like? When your child is at a mapping appointment for their cochlear implant, we run through tasks specific to your child, but there's a general pattern you'll notice that we go through at each appointment. We typically begin by talking with you, as Rachel said, about your observations and any concerns you have, and then we move on to performing a listening check of the sound processor, along with observing the general condition of your child's equipment. We'll check impedances, which is a measure that's very helpful to have, especially over time, that gives us some diagnostic information about your child's implants. We'll measure at times what's called T's or threshold. We'll measure the upper limit of comfort, sometimes called C's or comfort levels, or MCLs or M's. We'll usually sweep through those upper levels after setting them to make sure that your child appears comfortable. Then we'll turn the microphones on and let them listen to sound and observe their behavior and responsiveness to sounds before finalizing and downloading their programs. So let's talk a little bit more about each of those in detail. When performing a listening check, what we're doing is checking the integrity of your child's sound processor's microphones. So you aren't hearing what they're hearing. Rather, you're hearing whether the microphone quality is clear and crisp, muffled, cutting in and out. Any sort of abnormal sound quality is a sign that the sound processor may need to be repaired. Your listening check equipment comes in your activation kit and looks different depending on which company's product that you have. You can see here an example from Cochlear America's Advanced Bionics and MedEl, but typically it looks like a piece that connects to the processor and then some earphones for you to put in your own ears and listen. And as you get used to listening to those microphones each day, you will be able to notice if something sounds out of the ordinary. Oftentimes we will run through the Ling 6 sound check or say the sounds oo, e, ah, s, and sh. Those sounds check across the frequencies important for speech, and you can make sure that those all sound crisp and clear. So then we move on to connecting your child's sound processor or processors to the programming equipment and doing some measurements. Before we talk in more detail about those, I'm going to talk through what the electrode looks like within the cochlea to help orient you to the next slides that you'll see. So the cochlea is shaped like a snail and arranged with high pitches towards the base or the entrance to the inner ear. And as you travel up that snail shell to the apex or the top, you go lower and lower in pitch. And similarly, when the cochlear implant electrode array is placed into the cochlea, it's threaded right up through that snail shell. So each electrode contact is responsible for a different band of frequencies or a range of frequencies, with the higher pitch electrodes being at the base of the cochlea where it's tuned to pick up those high frequency sounds well. And as you go up the cochlea, each one of these dots that you see, this is an x-ray of a cochlear implant inside the inner ear, and each one of the dots represents one electrode contact, threading in further and further and traveling from high pitch to low pitch. So one of the first measurements that we will do at each appointment, regardless of what type of device your child has, is called impedances. Impedance measurements are important because they provide information about each of the cochlear implant electrodes, and they can provide that information over time. So in general, impedances are higher at activation, then they decrease over time as your child gets more experience listening to sound and more wear time. That wear time needs to be nice and consistent so those impedances level out and stay very stable. These patterns can help us diagnose device issues and guide our mapping. They can tell us if there's a short circuit on an electrode or an open circuit, and they can also give us some information about how battery life may be impacted. After we've checked your child's device impedances, we will move on to programming their cochlear implant. So what you're looking at here is a programming screenshot from one of the device manufacturers, Cochlear America's. You're seeing electrodes across the top. So each vertical bar is one electrode going from low pitch on electrode 22 to high pitch at electrode 1. And then the bottom of the screen is a very low current amount going up to higher current levels towards the top. When we're programming your child's implant, we want to set a couple things. We want to set the amount of current that your child can just barely hear, as well as the amount of current that's loud but still comfortable to your child. So the amount of current that they can just barely hear is called threshold or T levels. And when we are setting your child's threshold levels, we will start with a nice audible sound. Each time they respond, we will decrease the current level until they stop responding, and then bracket up and down to make sure that we find the level where your child is reliably responding to soft sound. Next, we set the comfort level, or kind of the upper level of stimulation that's loud but comfortable. Early on, these comfort levels are set by taking the threshold levels and then kind of slowly bringing the comfort level up while watching your child's behavioral response to sound. And then over time, as they get older, they'll be able to provide more feedback on individual electrodes and move towards saying, that's soft, that's medium, that's loud, that's a little bit too loud. but that will all take time. The area between the threshold and the comfort level is called the dynamic range. And at first, when your child's device is activated, that range will be small. Their tolerance for current is very little. Sounds are squished together. So soft and medium and loud are all in that small range. And as they use the device consistently and gain experience, that range grows. And we can put soft and medium and loud kind of a little more where they belong in relation to one another. The sound gets clearer while still staying nice and comfortable. Next, we'll take a look at a programming screen from Advanced Bionics. This is very similar with a few key differences. You're still looking at each vertical area is one electrode. The small notches that you see on the screen are called your most comfortable loudness levels. So we set this device a little bit differently. We turn those current levels up for your child until we find the level that's most comfortable for them on each electrode. And again, this is typically done by watching where they begin responding to sound and then slowly bringing those levels up over time based on their comfort, their responsiveness to sound, their speech and language development, and feedback from your child's educational and speech pathology team. In some cases, you may notice that the threshold levels, similar to the prior slide, are set with individuals with Advanced Bionics cochlear implants, and sometimes they are not. That's a key difference. Those threshold levels don't always need to be set for a child with an Advanced Bionics implant, though they often can be to help make sure that soft sounds are audible. And finally, this is a look at a programming screen if your child has a MedEl cochlear implant. Again, you have a vertical bar for each electrode, and you're setting the level of MCLs, or maximum comfortable loudness. So again, we want those current levels to be at a point where it's the upper limit of what would be comfortable to your child. And similar to the prior programming screen, you may or may not see threshold levels set if your child has a MedEl cochlear implant. Either way is okay. It's important to look at more than just programming levels when evaluating what's proper for a child. We look at the whole child, their performance, and their feedback from their educational team. So you might be asking yourself, how in the world are we going to get all this information from a small child? Children can perform visual reinforcement audiometry at an age as young as 6 months, quite accurately. And as they get older, they are able to move on to conditioned play audiometry. And we at our clinic and at most pediatric audiology clinics have a variety of toys and games to help keep your child engaged and having fun while also working. That being said, in many cases, it can also be helpful to have an objective way to verify programming levels to make sure that we're giving the right amount of current on the right electrodes. So behavioral mapping relies on your child to accurately identify that they heard something and respond to that. Objective tests can do this without as much feedback from your child. And one objective measure that we use is called electrically evoked stapedial reflex testing, or often referred to as ESRT. So to understand ESRT, we have to first talk about the stapedius muscle in the middle ear. The stapedius muscle is a muscle that connects to the middle ear bones and contracts in response to loud sounds. So loud sounds come in the ear, they vibrate the eardrum, and then travel through those middle ear bones to the inner ear. And if they get really loud, they can be damaging. So our bodies have evolved so when that muscle contracts, it stiffens those middle ear bones and dampens or softens the sound slightly to protect our inner ear. The interesting part about the stapedius reflex, or this contraction, is that your brain can't tell the difference between a loud sound from the environment and a loud sound delivered through the cochlear implant. So we can use a piece of equipment called a tympanometer. It's a small plastic piece that sits in your child's ear and measures that reflex or that contraction. So we have your child's cochlear implant hooked up to the programming software, and we deliver some beeps. And we measure where we start to see that contraction happening, and that correlates very well with programming levels for cochlear implants. The caveat to ESRT is the child has to be still and quiet. The tympanometer can pick up on swallowing and movement. It's quite sensitive. So if we are going to attempt ESRT, oftentimes we work with the family to identify something that's very engaging for the child. Sometimes we'll have them watch a movie on an iPad or something that will allow them to sit very still and quiet. So it's not foolproof, and it still does require behavioral compliance from the child, but it's a great way to verify programming levels. Although we're talking about cochlear implant programming today, I think it's important to make a quick note about bimodal considerations. Bimodal means that your child is listening with a cochlear implant on one side and a hearing aid on the other. And in these cases, it's important to discuss technology options with your child's audiologist. A cochlear implant is a long-term choice. Once you have the device implanted, it typically stays, and you're working with that device manufacturer for many, many years. As opposed to a hearing aid, which can be changed, you can switch between manufacturers every few years. So what we recommend is to talk with your audiologist about the cochlear implant, and then talk about any compatible technology for a hearing aid. Each cochlear implant company has kind of started partnering with their technology with different hearing aid manufacturers. So there's an option for everyone, but it's important to take into consideration that the cochlear implant is a long-term choice versus the relatively shorter-term choice of a hearing aid. So after we have set your child's threshold levels, their comfort levels, and downloaded their programs to the processor, we start looking at their performance. We usually start evaluating performance at about 4 to 6 months after your child's implant was turned on. So those first few months are, as Rachel said, acclimating to the implant, perhaps listening with progressive programs that allow you to slowly bump up the current levels at home, and allowing your child time, for instance, in auditory verbal therapy or listening and learning at home. And then we start evaluating their progress. We usually start, as I said, at 4 to 6 months, and then annually after that first year. And the exact type of testing that we use depends on your child's listening experience, their language level, and their cognitive abilities. We often start evaluation by looking at your child's sound detection with their implant. So in this test, we are in the sound booth presenting sounds through a speaker while your child is wearing one or both implants, and evaluating the softest level where they will respond. We typically do this using visual reinforcement or conditioned play audiometry in a similar way that we do during programming. So we are looking for your child to respond at about 20 to 30 decibels in the sound booth. And the reason we're looking for your child to respond at this level is because that makes sure that all the sounds of speech are audible. So on this audiogram, you're seeing low pitch going over to high pitch on the right, and then very soft at the top going down to very loud. And I like this audiogram because it gives some concrete examples of different sounds that fall at different decibel levels and frequency ranges, so you can kind of have something to compare it to in real life. And then you also see what's called the speech banana in yellow, and that's the area where many of the sounds of speech are at. So we need the child to be responding at a softer level than all of those sounds to make sure that they can hear them. Now, in more recent years, we've moved away from the speech banana towards something called the speech string bean. And that's because, as you can see, the speech banana leaves some of the softer sounds of speech, the consonants, that are very important for not just hearing speech, but understanding what it says. It leaves them unheard in some cases, whereas the speech string bean shows a level of detection where your child is definitely hearing all of those sounds. It's really important that children have optimal access to sound because they're learning language. Adults, as they lose their hearing, can use all of that knowledge that they've already gained in life to fill in blanks when they miss something, but children don't know what they're missing because they're still learning and developing language. So we really have to make sure that the sound is very audible and of great quality for them to learn to listen and to talk. But detection alone does not give us a full picture of your child's hearing. That tells us that soft sounds are audible, but what about louder sounds and the clarity of speech? So we look at evaluating speech recognition in a few different ways. When a child's very young, we start with parent questionnaires that ask you about how your child responds to different sounds, speech, and directions at home. It looks at a lot of pre-verbal skills and device bonding to see if they're bonding with their cochlear implant and progressing well. And then as their skills continue to develop, we start with what's called closed set speech measures. On closed set speech measures, that just means that we ask them to say, point to a picture on a card. There might be 6 or 12 options on the card. So there's a limited amount of choices, and then so a higher probability that they might guess and get it right. And then as they progress through those tests, we move to open set speech recognition, which are the hardest tests and quite useful for evaluating a child's progress. We begin with single syllable or multi-syllable words, so we might say the word baseball. And then we move to single words, like say the word cat, single syllable words, sorry, like say the word cat. And then on to speech, such as sentences, in quiet, and then importantly in background noise. And the reason that we test in background noise is because the world's noisy, and classrooms can oftentimes be at a signal to noise ratio, meaning the speech versus the noise is either the same or the speech is only a bit louder than the background noise. So it's important for us to know how your child hears in those noisy settings so we can help talk to you and to them about any assistive technology like a microphone the teacher might wear to make sure that they can hear all of the sound and learn in classrooms. I talked a lot about what you do with an audiologist in these appointments, but really it takes a village in order for a child to succeed with their cochlear implant. You as a parent or a caregiver are one of the most, if not the most important factor. Your audiologist is a team member, your surgeon is a team member, but there are some other important team members as well. I'll talk a little bit more in a moment to you about your auditory verbal therapist, who's a specialized speech language pathologist. Each cochlear implant device manufacturer also has a recipient support team that can help with going over equipment and troubleshooting, since it can be hard to make it into our office, and they can oftentimes help you either virtually from home or by the phone. We are happy to offer a parent mentor program here through our Sound Support Outreach Grant, where you can talk with other families who have walked this journey as well. We also have, through our Sound Support Grant, the option to coordinate and collaborate with your child's early on daycare or educational team to bridge that gap between the medical and the educational facets of their life. And then young children also have their early on and older children, their educational teams that are imperative for success and ready to help you as you go along this journey. So I said I'd talk with you a bit more about auditory verbal therapy. Our program is happy to offer auditory verbal therapy with our 3 listening and spoken language specialists. And these therapists are speech language pathologists who are specially certified to help teach children to learn to listen and talk. They guide, counsel, and support families whose children are learning these big tasks. So they're going to be helping your child learn to listen, to communicate effectively using spoken language, and to reach their greatest potential with their hearing technology, whatever that may be in your specific case. They're also imperative in helping establish full-time device use really quickly. One of the biggest predictors of success that is under your control with the cochlear implant is how often your child uses the device. We need a child to be as quickly as possible using that device at least 10 hours a day in order for them to learn to listen. If you think typical hearing children's ears are on all the time, even if they're not actively attending to speech, their brain is taking it all in. And so we need to mimic that with a child with cochlear implants and have those devices on as much as possible, since they are already, we'll have them off sometimes when they're sleeping and that sort of thing. So your auditory verbal therapist will work with you on different options based on your child and your preferences to help keep the devices on and to work towards that full-time use goal. It's really helpful to have someone coach and mentor you, because there's a lot of options out there to assist with device retention, but not the same one works for every child and every family. And therapists work closely with the programming audiologist to ensure that the mapping is correct and your child's language is progressing. So we're constantly in each other's offices talking about what a child is detecting and what they're missing, and then making necessary adjustments to make sure your child hears as well as they can. And then therapists also assist with referrals to other professionals when needed. So children are often implanted very young and we don't know what their developmental future looks like. So if we start to see signs that your child may need additional support or evaluations, your auditory verbal therapist is an excellent resource to help guide you in getting those referrals. This is just a look at the Michigan recipient support team. So if you're viewing this webinar from outside of Michigan, your team members may vary, but there is a person in your area that does these same roles. So each company has some specialists who are wonderful contacts for you as you learn how to use your equipment. As pieces break, children, if they're using their device full time, parts break, they're hard on things, and they and we can help guide you in getting replacement parts and making sure that your child remains, what we say, with sound or on the air. All their parts are working. And as we wrap up, I just think it's important to say that, you know, we all have rough days, adults and children included. When you're coming to your programming appointments, the best you can do is prepare as best you can, and then give yourself and your child grace. We know many families travel from a long distance, and it can be incredibly frustrating when you're in the programming appointment and your child melts down. This is normal. It happens to everyone. We're very used to needing to add on appointments when a child doesn't participate, and we will be happy to assist you in making sure that we schedule the appointments that your child needs. Kids just have short attention spans, and sometimes we have big goals of what to get in an appointment. We might be trying to program both ears, and they can only get through one. It's much better to get a great map on one ear and then come back and do the other than to have kind of a mediocre map on both ears. This hard work at the beginning to make sure your child's mapping is optimized and their progress is good will save you time and energy in the end, and it will make sure that they get good sound and develop speech and language as quickly as possible. On that note, I hope that you have enjoyed our talk today. We would be happy to talk more with you. If you have questions or comments or need assistance, both of our emails are listed here on this slide. We would love to hear from you. If you have other ideas of topics you'd like to hear about as a parent of a child with hearing loss or cochlear implants, we would love to hear those as well. So please feel free to reach out at any time. Again, thank you for listening. We so appreciate your time.